differential leukocyte count or DLC. The first step in preparation of a slide for differential leukocyte count is to mix the blood sample gently. Put a small drop of blood on one end of glass slide and use another slide to spread the blood film. One end of the blood film is thin and feathered, and the second end is thick. After spreading the blood film, wait for the blood film to dry, and then the most important is to label the slides. You can write a number or date or the name of the patient on the thick end of the blood film. After that, fix the blood film in absolute methanol or ethanol for 3 to 5 minutes. Remove the blood film from the alcohol and wait to dry. Then stain the blood film in Giemsa stain. Giemsa stain used here is 10% Giemsa stain. The blood film are allowed to stand in the stain for 40 minutes. Before starting the differential leukocytic count, prepare the differential leukocytic count table. Also, you can count the cells under the microscope using a differential counter. Remove the slides from the stain and wash with buffered distilled water. Wait for the slides to dry and then examine under the microscope. Put a drop of oil on the thin end of the slide and then examine under the microscope. The examination is started from the feathered end, from the thin end, and then pass toward the thick end in a method known as 4-field Mender method. In this field, 5 neutrophils. The blood used here is camel blood. Also here 1 lymphocyte and 2 neutrophils. So move on the slide horizontally. Then this is the third field, 3 neutrophil and 1 monocyte. And then upward for about 3 field, 2 neutrophils and then no cells. Horizontally again, 4 neutrophils and 1 lymphocyte. And then 2 lymphocyte. Count at least 100 leukocytes in the blood film and then calculate the relative number of the leukocytes. To obtain absolute number of each type of WCs, multiply the proportion of each type of cell by the total WCs count.